Okay, we are cooking. We're good to go. Yeah, no, absolutely. And again, thank you for, answering these questions because I'm sure, like, especially I think with peak states and the institute being kind of something that wouldn't fit in mainstream thinking. I think some parts would, and I think that's a great entry for a lot of people who are talking about like trauma therapy and are seeing connections. It's a good way to start. And some, I mean, like I said, reading the books, reading about specifically Silent Mind, that question of the tribal block and seeing how it's connected to, it seems like it can be connected to both positive and negative kind of things or a relationship between people, like the negative and positive things. I could be wrong, but also just the idea of if society ever regressed to like a tribalist kind of mindset and it was just a lot stronger than it is now, like not just teams and countries, but maybe even smaller, like would somebody going through the Silent Mind process and then for whatever reason, I don't know, moving to a more tribalist society or society regressing hypothetically to earlier kind of levels of consciousness, like would that person kind of be at a disadvantage at that point? Would it be would that be bad for them to not have that kind of block?
That's a very good question. Let me just explain a little bit more. You mentioned the Silent Mind process. The Silent Mind process is one of the trauma healing or peak states processes we have in the Institute, which is the most famous one. But there are others as well. And the Silent Mind basically gives you a silent mind. Okay, so all these talking, this background talking, this being in Grand Central Station and having somebody and listening to all these people, perhaps even listening some negative comments about yourself and so on, this will cease. Okay, so you can go to an ashram and try to meditate your way into the silent mind and, well how they call it, shut off the monkey mind.
Mm-hmm.
Or you can do 2 hours, 3 times, and basically, or 3 or 4 times, depending on how much work there is to do. And then you have that silent mind. And the other thing the silent mind process does is it gets rid of the tribal block. And the tribal block basically is something which was really helpful in former times where we were a group of people and where we had to stick together to survive. So every outsider was a potential threat. Whether it's really a threat like a soldier coming to a village or like somebody marrying into another village and getting like STDs or stuff like this. So being inside a group was always favorable in former times.
Mm-hmm.
And we have remnants of that we define that we many times say us and them, that we separate our group. So us, the football team A versus the football team B.
Mm-hmm.
Or us, the kids from that school, and the kids from that other school, or us, the guys versus the girls, or like this. So it's many times we have these groups because it just feels good to be in a group, to just belong. And then there's like this, like also professional groups, okay, us the actuaries versus the doctors or whatever. So there's always groups,
mm-hmm.
And you don't have that need after doing the silent mind process. You don't have that need to differentiate anymore. Just gone. And also the tribal block tells you many times what you should do. Okay, how you should sit, how you should behave, what's good behavior, and if you're having bad behavior, it basically sends you bad emotions. And the third thing are the chords. So humans build interaction, and we call that chords. So there's corresponding trauma in a man and a woman connecting, mm-hmm. and these are chords. And we notice these chords, especially at Christmas, when we want to celebrate a peaceful Christmas. Everybody wants that, but when people come together, it's most of the time not peaceful. And that's because everybody's subconsciously pulling on these chords, and then the other one gets emotional and gets triggered, and then we basically have what we see Christmas, or what we see in the grocery store when kids want to have their chocolate at the end at the cashier, and then they exactly know what to say, so mommy or daddy will give in. And after having done the silent mind, these cords are gone, so you live a much freer life, and your kids can't trigger you with that anymore. And that's really a change. So you can have, as a parent, you can have like a very, very good guideline for the kids. You're not like, they can't manipulate you so easily. You can just say, no, today there's no chocolate, and I don't know, Sundays, yes, there's chocolate, or something like this. So you can make up your rules, and when the kids learn that there are rules, they can learn that it's favorable to accept these rules, and makes life much easier as a parent later, and for them as an adult. Mm-hmm. So that's what the Silent Mind package resolves. And now your question was, if we resolve that, can that have some negative impacts? And the interesting thing is, we think that and that's just a hypothesis, that in some societies people knew about parts of these mechanisms. For example, one idea is that the burqa in Islamic traditions for women, mm-hmm. it's a religious thing, but could also have had the effect of not building these cords. Okay, so the woman was in the burqa, and so there was no cords between other men, and that would keep the woman pure. Just an idea. Or the guild, or the I think that's how they call it. That was like to separate us from them, and that was within society. So when we resolve trauma, mm-hmm. we heal something which was broken, which was not okay, which was out of balance, and we get back to balance. Mm-hmm. And then it doesn't necessarily mean that we can't go that route which we would have gone before. So when before I said us team A versus team B, after doing the tribal block, after resolving the tribal block, after doing the silent mind, I still can say us team A versus team B, but I don't have to say it to feel good. So it's basically a choice that you have. Before you didn't have a choice because you had to say it, otherwise you would feel emotionally negative, and there's much subconscious, so it's not always a conscious process. Mm-hmm. It's just a slight feeling. You say, I have to do it. Or sometimes even it's automatic. You don't notice until somebody tells you, because much of our actions are automatic. Like when you're walking and you're looking at your cell phone, uh-huh. your smartphone. Most of the time you're not hitting the pole. You're just walking around because your subconscious is guiding you. It sees that, but you don't notice. Or when you're driving a car and listening to an audiobook, after several minds, you don't know if you passed the gas station or not.
Right.
Just if you pay attention. So much of our behavior is automatic, and therefore, if we have traumas, much of our automatic behavior is trying to avoid pain or trying to avoid unpleasant feelings. Okay. So when you resolve trauma, when you get a different next level of consciousness, you still can mimic, you still can imitate it, but you don't have to.
Okay.
Does that make sense?
Yeah, it does. But I guess you're saying that after we do this process, or someone does this process, then the need for the feeling that you get from not connection, but group, like affiliation, kind of vanishes, so that you don't need that to feel good, correct?
So the negative feeling vanishes.
The negative feeling.
If you leave the group, okay. So if, for example, if I think of doing something outside my professional group, mm-hmm. I can do it. Okay, I don't have these negative emotions of, wow, I'm leaving my comfort zone. Is that okay? Do I need to talk to my boss first? Do I need to talk to this one supervisor first or something? You just do it.
Okay.
Say, okay, if I do this, if I give that white paper to our competitors, that might have legal complications. Mm-hmm. Okay, so you still are conscious. You have choice about it, but you don't have that emotion anymore. And that was now a negative example. If you go to the positive example, it's about innovation. Okay, mm-hmm. How many times do we, especially in big companies, do we fail to innovate things because we are afraid of what the other group might say?
Right.
Okay? And because we not only fear their judgment, but we fear, if somebody says that's stupid, why do I care? Okay,
Yeah.
I care because that what he says or she says gives me negative feelings.
Okay.
And when I have negative feelings, I'm usually helpless to my feelings because most people don't know tools how to handle and how to deal with their emotions and how their feelings. And so I'm trying to avoid some situation which will make me feel bad. Okay, and that's when I'm getting outside my group, when I'm getting outside my comfort zone. That is something I learned from child on. Okay, because if I did something outside my comfort zone or outside what was supposed to be, there was a negative remark from my teacher, and that gave me that negative feeling because the tribal block said, "Bad, see, don't do what you're told." And now the tribal block is gone, and now you can simply do it, or you can not do it as you choose, and not as you try to avoid negative feelings. I hope that makes it clear. It's a little bit complicated, but basically it's really the subconscious always avoid negative emotion, tries to avoid negative emotion, and the tribal block gives you negative emotion once you leave your group.
Okay, that makes sense. What about in terms of the positive? Well, I think you answered it, but does it affect how you feel about the groups you're in? Like the positive feelings? Like do people that, like, let's say I'm in a group of I don't know, like a sports team, right? And I have a close connection with them because they're, I don't know, we all play a sport together. Does that go away? Does that do they feel like they don't want to be close to you because of the tribal block being gone?
No. That's they just that's for them. That's normal. You're just a normal person. You're a little bit strange because you do things they wouldn't do. Okay, so I don't know. So you would go to your boss with a new proposal of a project, while others in your groups, your peers, would say, that's very risky and very innovative. I don't know what you would do if you would do that, if I should do that or not, and so on. And you would just do it. But you will still have the positive feeling because the tribal block just tries to keep change away and keep you in this place where you are. And when that is gone, you basically can explore what is fun, what gives you positive emotions, and then you just do it.
Okay.
Because you don't fear. After a while, you learn. You don't have to fear that thingy which was in the back and was giving you these bad emotions because it's gone.
Okay.
And I just saw we just have a new listener, and perhaps we can promote her as well if she likes.
Absolutely.
And, joins the call, and just so you know, we are recording this because we are just so few people, so we are just recording. And if you like to join, I'm just going to invite you, and let's see if she takes that invite.
Hi, Inka. I sent her one to speak. So if you, there we go.
She's here. Yay.
Yeah. Hi, guys. Okay, I'm around to try this. I'm not a pro at this, so that's actually
neither are we.
just something that Daniel invited me. How are you doing?
Good. No, neither are we. We're just trying to have a conversation, learn, try to see if people want to join and chat about their experiences with trauma healing in all forms, how they got started, what they've seen. But we're pretty. I mean, Daniel and I have been talking about this for maybe like a week or two, and it's still pretty new. I'm still trying to figure out Clubhouse. I thought it was going to be easier to invite people and join a chat, but right now it seems like there's a little bit more to learn before we can do that.
Oh, okay. Thanks for doing that, though.
Yeah, of course.
Inka, how are you?
I'm in weekend mode.
Good. So Inka is an advanced therapist with the Institute, and she actually is my teacher, so she knows way more than I do.
So I'm talking to my friend Jerry, who's starting medical school soon, and I actually recommended him to you, Inka, because of Daniel. And
okay.
Yeah, I think he's getting ready. He's been chatting with you about, I think, a process that he wants to do with you. I don't know if I should talk about it, but yeah, he told me. I recommend him to you.
Oh, okay. That's his his abbreviation for his name. Okay.
Yes.
Then I know
Yes. I'm sorry. That's what I call him. That's what I've been calling him for years. Yes.
Okay.
Yes.
And that's another topic that to me is really interesting in ADHD and how we see it, because I feel like in the past decade it's seen a lot of like mainstream. I don't want to say mainstream, but I guess like in how most people see it. I feel like most people see it as like within the paradigm of like there's like a chemical deficiency or there's something wrong with you. Then it's also been seen as the guy who coined it. I remember when he passed away, saying that it wasn't a real thing, and then I feel like in the past few years I've seen it more with like comorbidity with other kind of mental like issues someone's having, like if they're dealing with depression or like I feel like there's more comorbidity with ADHD. But I'm curious to know how you guys see it at the Institute, to be honest.
Well, if I may, Daniel.
Yes, please.
My take on that, or rather the Institute view, is that a lot of people get labeled with that ADHD thing, and they're totally different types of problems. So we need to make sure that whenever somebody with that label wants us to help them, that we're really dealing with this particular problem that we have identified as the type of ADHD that we can help with. But having said that, there are a number of problems that can cause that, and we cannot help with all of them, but we have an idea about like 3 or 4 of them what to do.
Okay. So you're saying there's more than one quote-unquote way to what we call ADHD is more than just one thing.
Yeah, diagnosing in that field, even for the mainstream medical, honestly, I don't think it's a cut and dried type of diagnosis, like they think, oh, it could be something like that, so let's write that.
Okay.
It's not something that's 100%, we're 100% sure that is this and nothing else, that's just the sort of thing that is closest to what their experience is or what they know.
Got it.
Yeah. So when in somatic medicine, you usually talk about a root cause, okay? So a heart attack is a blocked artery at the heart, or an appendicitis is an infection at the appendix and the end of the colon. So you're describing what actually is broken, what is infected, what is not working anymore. In psychiatry, you describe a complex of symptoms, okay?
Yeah.
And these complex of symptoms don't necessarily need to have the same cause. And the same as what Inka tried to explain with ADHD is that from the Institute's point of view, there can be many, many causes that the Institute identifies and can treat. Or for example, with depression as well. I think we have 7 or 9 different causes. 9, right. And it might be that every year there's another idea what else can cause depression, which we need to test when we work with somebody who has depression to help him resolve that, because depression, in medically speaking, is just a complex of symptoms. We need to interview them and have very detailed diagnosing questions with them. Yeah. Yes.
Okay. So you're saying that these kind of these things we label as mental illness, or I personally don't like that word. I think it's more, because I think it's so much more connected to the medical field, and me personally feel like it takes away from the perspective of solutions, like of healing. At least, even though it's an illness, like I feel like it takes away from the prospect of there being like healing from it. But you're saying that when you're saying, like, for example, ADHD or depression, you guys have found that is it still the same feeling but caused by multiple causes, multiple traumas, or it's just different, or different people feel different things, but we call it all one thing? Does that make sense?
That's a difficult question, because we never know how somebody feels. They describe what they feel, but the same is true, for example, for colors. We have certain people that perceive colors definitely different, and in regular day life it doesn't really matter, but when the colors get a little bit shady or the light is dim or something, then we notice that there's different interpretation of colors, and the same is true with feelings. Well, we know in the Institute that if somebody says he's got diagnosed with depression, that there are 9 causes we need to look at to see if we can help him or her. Doesn't mean that we can, but that these are the ones that we have identified.
Okay.
The same is true with ADHD or with, for example, OCD, or anxiety, and this label can have multiple things we need to check in the Institute.
Got it.
And the people would describe these feelings as somewhat different. So that's why I'm saying that we have to ask a number of diagnosing questions to see if we can narrow it down to one particular cause.
Okay, that makes sense.
And it still can be 2 or 3, additionally.
Oh, it doesn't have to be just one. It could be multiple things.
Yeah.
Got it. Well, before I ask anything else, I see that Nick is here, and Nick is actually a really good friend of mine. We worked together a while back, and I'm really glad you're here, Nick. Hey, what's going on? He plays music. He's pretty good at it, and he's actually I don't know if this is okay to share, Nick, but I know that you're also here on Clubhouse because of wanting to move your music forward, and at the same time doing it to kind of get to meet your biological parents through this process. So, I mean, I don't know if you know this about me, but for me, like, a lot of the music I write is also tied to my emotions and to healing and kind of my subconscious coming out through my music. So if at any time anything that we talk about here is interesting to you, or you have a question, feel free to speak up. I just sent you an invite, but I know you know how to use this probably a little bit more than I do. So we're just talking about Daniel and Inka are both trauma therapists with an institute that I've been following for a while, and they're both very good at what they do. So I'm taking this time to chat with them, ask some questions myself that I'm interested about in trauma healing and what that means. And yeah, just moving this conversation forward about growing and the importance of our emotions and how not healing can get in the way. So.
Yeah, that's awesome. And thank you very much for that introduction again, Sergio. I think from my perspective, we are all perfect. Yeah. But we sometimes learned from our childhood, learned patterns, learned things to avoid certain emotions. And one of the things that many people struggle with is to accept that what they internally feel and what they think is not necessarily their personal truth. It is just one part of them, one idea, one reaction to a certain situation, which might be traumatic or not, and then we can change that because we can ask certain questions, and then we can find a trauma which might help have a person go into a certain direction, and then we heal that trauma, and then the person has the freedom to choose. So, for example, if you're looking for a job and you are thinking, oh my God, it's going to be hard to find a job. Well, first of all, it's not necessarily true, but it's your truth. And with that mindset, it's going to be hard because you might be looking just in the wrong places, or you might making yourself even more stressed when you're, for example, in an interview process, because you always have in the back of your head this voice telling you, it's hard, don't mess it up, it's hard, don't mess it up, don't say that, don't sweat, don't look, and tells you all these things you learned somewhere in a training or in school or somewhere. And basically what's most of the time behind it is just the fear of being insufficient, the fear of not having enough money or whatever. And when we look at that fear and we resolve that underlying trauma of that emotion, then the person just sits in the interview process and just talks. And normally that is more friendly, more vivid, more connecting to the people sitting in the interview with that person, and then they just hire them. While the other person, always thinking of doing everything right and listening to what mommy said and what daddy said, and they're always in the back of their heads, they are not that friendly. There's not so much vibration, emotion, or whatever you want to call it in that conversation. And then there's like this feeling in the interviewer who says, I'm not sure. I mean, he has all the grades and he has everything there, but yeah, let's take the other one. Okay. And then basically, it's a self-fulfilling prophecy. You thought it's hard, and you make it yourself hard because you always have these voices in your head and these thoughts, and then you actually didn't get it. And then you collected proof that it's actually hard. Now you have cognitive proof that it's hard. And when somebody says, "Oh, it's simple, I just got the job," you might get even triggered because you have that truth, and it's not your world, and how can that be? And then all these emotions come up, and that makes life complicated. Okay, so and I think these are examples everybody has experienced in the past. I have experienced them as well, and but now, since I've studied with the institute, I now am a therapist, but just as a regular person, it's so much nicer and so much easier to live, okay? Because these thoughts, these emotions are not there, and I just can say, okay, what do I want to do next? And so
if I can add my 5 cents here, because you used the term trauma, and I don't know if Nick and Sergio are familiar with that idea that any time that you're not peaceful and feeling without heaviness in the body and feeling calm, when that's not present, then there is actually something triggered that we term a trauma because it actually was a traumatic event in the past that has come up. And many people would say that's normal, and if we say normal is the kind of life that people experience averagely, then yes, that's true, but I don't think it has to be normal. For me that is not normal anymore. And when things are not feeling calm, peaceful, and light, then I know, okay, I gotta go and do some stuff and shift things so that I can feel okay in my life again. And I think that's a pretty new paradigm, especially once you've understood that there are tools that can help you do that. Fairly simple in most cases.
Yeah, I agree, and I am familiar. I think the best way I heard it was, I think it was on YouTube. I think it was Grant's his explanation that's on YouTube. I really like it because I think most people think of trauma as like this one thing, because it's such a powerful word. Like, it has so much charge that when you hear trauma, like, people think of they think of like war, or they think of rape. And I'm not saying, I know you guys know I'm not saying those aren't the things, but everything else kind of falls by the wayside, and people forget that. I feel like we are living in this highly traumatized society. Like, most people have become, including myself at times, like when I'm having like a bad week or a bad day, or it's a very stressful like work week or something. Like, just a good example is like we have new tools to cope and to distract. We have, people call it binging, like it's fun to binge TV shows, but it's the same thing. It's just a way to distract from whatever's worrying you. Or I think a big reason why the U.S. is like, I think the U.S. has so many material things also, and so much like people are overweight here because of the same things. It's how we know to cope, and I think that's like the mentality, the paradigm that most people live with. It's coping, and I feel like most techniques or therapies, like at their core, like symbolically, that's what they have. They have coping as like what they do. And I feel like unless people start thinking and shifting their mindset into the word like healing, you'll just see kind of the same thing. And it's great to see more trauma techniques showing up. I wish that there was more info on peak states, because I feel like I've done quite a few. I've tried EMDR, and I've tried somatic experiencing a little bit, just a little bit. And I've done breath work, and I did psychotherapy for quite a number of years, and they were all helpful. But I feel like I'm reading like about wholehearted healing and learning these things has been really, really helpful so far. Personally, like it's helped me feel like I don't have to rely on someone. Like whatever I can heal myself. I can work on my emotions. My emotions they're not overwhelming, and I need to talk to somebody about how I'm feeling. I can begin to process them, and that's like life altering. It's incredible. It's still very challenging, but it's also a wonderful feeling. And so I wish that like the ideas that the Institute has just were more out there. Like I wish we were, I don't know, 20 or 30 years in the future or wherever, because I find it so interesting.
I love listening to you say. You just put it very nicely. Yes. For me, I have made the similar experience that it's life-changing. Transformation is my word for that. And but it's very important to stress that trauma, and there are several categories we can talk about. Some people talk about big T traumas, which is like war, rape, and car accidents, and so on, and little t or small t traumas, which is when you drew something and you showed it to your mommy, and your mommy said, "No, I don't want to look at it," because she was preparing the dinner or something, and you as a small kid just said, "Huh," and the second day the same thing, because just by accident you were doing it at the same time. And then this is something you carry with you. Okay, in the Institute we have a little bit of a different explanation of these traumas and how they are created. There's a whole scientific model behind it, but basically from your perspective, from the feeling perspective, these are things you experience in your life, and they still hurt, and afterwards you might not be able to be good in painting or in drawing or in art or whatever in school, because you always have in the back of your head, my mommy didn't want to see my drawings. Okay, and with these tools we are having, it's very easy to resolve these things. And usually what I also like, because you mentioned coping, yes, many other therapies do coping because that's the best they can do. Okay, and we have a way to tell actually that a trauma has been resolved, because we have that state. And every client I have, for the first time, when they actually resolve the trauma, they get into that state of being calm, peaceful, and emotionally light. It's a beautiful state. And we can be, most of the time we should be actually in that state, but most people don't experience that because they're stressed and they run, and then they take coffee, and then they need their blood pressure medicine and so on, and they get their heart attack because they're completely all the time in stress, and they're triggered all the time, and the body doesn't really get rest. And because that feels not nice, well, then they are binge eating or binge watching Netflix or whatever, because that at least gives a little, or taking drugs, that gives a little bit of release. But not good idea. There are ways to, friendlier ways to deal with these situations.
Yeah, absolutely. There's something that I feel, there's this question that I always have in regards when I look at other techniques, and I feel like a good example is like EMDR or even somatic experiencing, and they talk about like single traumas and specific traumas, and it seems to me, and correct me, you guys, I feel like you guys might know better because you're in this field, like actually living it. You're part of it. You're helping people. But when I look at least the literature online, it doesn't seem like there's much for this idea of like complex PTSD, right? Like complex trauma, like when people, or especially when it's like a lot of childhood events or attachment kind of disorders and stuff like that, or not disorders, but difficulties with like your attachment and your attachment style. Does that make sense to you guys? That it's more difficult to treat quote unquote complex trauma, and what does that mean to the institute? Because it might be different. You guys might see it differently than more mainstream or more. I don't want to say accepted, but just more the techniques that are more well known to the psychology community.
So yeah, EMDR is a trauma healing technique. Actually, it's an evaluated and scientifically proven working trauma healing technique.
Yeah.
And it was discovered by accident.
Yeah.
Very similar to how peak state was discovered, step by step by accident, another discovery, another, and then added together. I think the most famous story for EMDR was that the founder, a woman, was very upset, and she took a walk, and then she was just looking to the left and to the right, and to the left and to the right, and to the left and to the right. And after the walk, she said, I feel calm.
Mm-hmm.
And then she observed that that's really working. And that's how EMDR developed. And they had, the advantage that they did clinical studies and trials. And so they are now accepted in the medical community. But what I think is that they actually do pretty similar things. They're stimulating meridians by looking left-right, and these are very similar to what EFT does. You're tapping on the left side or the right side of your eye to stimulate the meridians. And Peak States also uses EFT techniques to stimulate certain meridians, but has a model behind it, a biological and scientific model behind it, what it does. And that's one of the big pros, and that's why I stay with Peak States so long, because we have something that works always reliably. So we have the pre-situation, then we do the intervention, and then we have the post-situation, and we measure them. And actually, we have also this pay-for-results system where just when you get the wished-for results, the payment is due, because we know that it works and it works reliable. While sometimes with EFT, you're just tapping and then you get some release, but not the complete. You just get a little bit relief, not the complete release. And so that's something, usually in a peak state session, you will not leave that triggered, but you leave it calm, peaceful, and light. Okay?
Yeah.
Again, to PTSD or CPTSD, these are terms from psychiatry describing a complex of symptoms. Okay? PTSD describes certain symptoms people have after experiencing war trauma or car accident or something. And the complex is just added on, where certain things in the development didn't go right, and for us it's just a name. We just need to work with that person, see where actually their problems are. But the more a person has traumas, the more they are, as we said before, the depression can have 2 or 3 causes that we have identified. So with somebody who is claimed to have a complex PTSD, they possibly have more things going on there which need to be healed, and then there might be effects in between, and that makes it a little bit more complicated. But that's why, for example, in the symposium I just presented the schema therapy, where we basically mix these things, where we go from childhood emotional needs to what the trauma is and try to heal it.
Okay.
I would just like to add that EMDR is known that it doesn't work for multiple PTSD. It's actually a contraindication.
How come?
For complex PTSD.
No, multiple PTSD. Like multiple batterings, for example, in childhood. I've seen cases that get worse from EMDR with that. So with EMDR, you need to have one very clearly targeted event, and you basically need to exclude that there's similar stuff around.
Okay.
And I just want to say that that's not happening with what we're doing.
That's one thing I found super interesting, and like the fact that you're bringing it up is really interesting. Is I did try EMDR a couple times, and one of the things that I found that bolstered what I believed about the Peak State Institute, because there are things that I still like question, and like I've just for the most part, like I'm a newbie. I'm just learning, and I'm super grateful to be able to talk to you guys, first of all. But is that they also talk about trauma strings, so in a different way, right? That my therapist talked about it like that. That if you can find like the event that happened, like for example, like a certain I forgot what it was, but I think he talked about something that happened to a specific person. She went through a very traumatic sexual experience, and she was able to go back to like a few others that she'd had like back to back and kind of clear them. But you're saying that for the most part, like EMDR is not good to do that. That's probably not a good idea.
Okay. Now, you mentioned the term trauma string, and when we say trauma string, we are talking about repeating patterns that have the same symptoms.
Okay.
So in that case, you would actually we actually see that there's just one trauma that needs treating, so you wouldn't have to go through all the other types. Yeah.
Okay.
So in that case, that wouldn't be what I would term a multiple PTSD.
Okay, because it's technically the same.
If you don't know the model yet, that it looks a bit like the same from a distance, but you really need to examine if the symptoms are the same.
Okay.
And when I say symptoms, the physical sensations that go and emotional perceptions that go along with that in that particular moment, and all the seemingly similar moments, if they're not accompanied by the same emotions and physical sensations, they're different trauma strings.
Okay. So if they're connected by, I mean, like you're saying, you have to verify, you have to make sure that they are. But if they're connected by the same kind of feelings, you don't have to target all of them. You can target just like the earlier events.
Yeah, you try and go to the origin of it, and that's all. That will make everything else go away.
Okay.
That happened along the same trauma string.
Okay. That part to me was interesting, that they kind of mentioned something similar to you guys, but I feel like it was, when I tried it, for example, it was very difficult for me to. I was at a point where I wasn't really feeling emotions. I felt a lot of somatic sensations, like I didn't know why I felt the way I felt. And I didn't have like a specific event that was traumatizing when I looked at it. It didn't feel like that. And so I would try to do with EMDR a form of like somatic bridging, they would call it, like a somatic bridge, which would be the idea of like staying with a somatic sensation that held some sort of, negative emotion or painful sensation, and then just head back through it. But I had a big challenge, because what I ended up feeling was like a lot of frustration and like blocks. I don't know what to call it. Like I felt a lot of blocks and feeling like I didn't know what I was doing. My mind was like all over the place. Like I couldn't really just focus on what I was feeling, and I ended up just feeling very frustrated and leaving like triggered. Like I left feeling worse. I left feeling like terrible, and just frustrated at myself, and like I'm never gonna get rid of these like feelings that are bugging me right now, and they're painful. But
what, that sounds a bit like what you were talking about when I entered the room. That, I would say, sounds a bit like you might have had trouble with the so-called tribal block.
Exactly.
So the tribal block, as Daniel mentioned, doesn't like change, and you were trying to change something. You were trying to get rid of that feeling that was bothering you, and then the tribal block does this whole thing that your thoughts are going all over the place, and you're not able to focus on what you want to do. That's fairly typical.
Okay. I know you guys talk. I feel like the more I read about the institute and the books I've read, the more the idea of the triune brain makes sense, and it's super interesting to like, because you don't have to be like in this perfect state to understand it. You can kind of think about it on your day to day, and that's kind of how it felt. It felt like, I could be wrong, but like my thinking brain, like was the one in charge, and it was like that's how it protects me from feeling. Like it would be like, am I doing this right? What am I supposed to be feeling? And then when I would kind of feel something, I would start, like, it would think like, oh, am I feeling better? Is this what like healing a painful event feels like? It was always like trying to distract me. So like a lot of the times I feel like I live in my head, and it's very hard for me to shift my awareness to like my body. Well, no, to my body I can, but or to my heart, And I've been doing that lately with Daniel. Your YouTube videos are great, and I also I'm seeing Leonard Lasco's book and reading. He's got a couple of YouTube videos also on like opening up kind of like your heart awareness, so you can kind of like let these feelings of gratitude and love and actually feel them rather than like think them. So
say what you say is like, in quotation marks, the disease of our Western society, that we don't know how to deal with emotions, or many people don't know how to deal with emotions, and then just use our head to cope. Okay, so I always explain that. Imagine that I'm walking and I'm hit my toe on, I don't know, my tape, my desk, and then my toe hurts. And obviously my toe hurts, and I know the reason because I hit it, and then I just say, okay, I don't mind it. I just put it in the back, and I basically cope away the pain. But when I'm just walking and I don't hit, and then my toe started hurting, then I'm just always like, okay, why does my toe hurt? My toe hurts, and then you're just looking for a reason. You can't find a reason. Your toe hurts, and that makes you worry a little bit more because you don't know the reason for the pain, and the pain is there bugging you. And if you have a reason, if you have an explanation, you many times can just suppress or sweep your emotion under the rug, and then it basically is in the background. It's in the back. It's somewhere stored in your body, and then your body slowly doesn't feel that well, and then your body awareness, as it's called in psychotherapy, or we call it the center of awareness, is it doesn't want to be in your body because it doesn't feel nice. So you stay in your head, and then we have all these people just thinking and not feeling anymore. Does it make sense?
I would also like to offer another explanation for that. You mentioned the triune brains, right?
Mm-hmm.
And you mentioned the fact that you found it difficult to perceive emotionally, but you were just kind of like in a place where you would only feel body sensations, if I heard you right.
Yeah.
And that is something that can happen when those triune brains are not communicating very well. So if they're a bit distant from each other and not well integrated, then, like the part that goes along with the emotional part, emotional perception, the heart, what we call the heart brain, is kind of like not accessible. It's kind of not in communication with the rest of you. So you only feel the stuff that your body awareness would feel. And then your body and your mind are part of the picture, and they're thinking and sensing, but you're not getting the emotional content of what's going on.
Yeah. I think that's probably what.
And having told me that you are now doing exercises to integrate more, and that works better for you, makes me think that this guy probably has a very nice way of bringing your heart brain back into the picture with the rest of the brains.
Is that possible though? Like this, and I know at the symposium you guys had, that was kind of a question. It was this idea that I forgot what it was, but there was a question. I saw a question that was like, can you strengthen it, kind of like a muscle, as opposed to like somebody who's has it disconnected and it's not communicating well? Because I know there are people who have these three kind of brains, so to speak, like connected well, and they they are not kind of like in conflict, and they're kind of more like in synchrony.
Yeah, absolutely. Absolutely. We have several processes that target an improved connection between the brains. And that's one of the things that I also encourage in my students, that they work on that, because that's not a given, that just because they're not connecting doesn't mean that it has to stay that way. Again, you just have to access the kind of trauma that keeps them separate.
Okay. But
and if you look in the books that Grant wrote and the Institute published, you will find lists of peak states. And at the beginning, many peak states were very hierarchical because they were how well brains integrate with each other. And the second famous, if I may call it this way, peak states process we have is actually the inner peace process, which brings the heart brain and the mind brain together, closer together, and which gives you a feeling of inner peace. So basically, trauma from the past is not presently triggering you anymore right now in the present. And that feels very, very nice. I just had this week somebody who had a very, very, very harsh breakup, not being able to sleep, and always having this thinking carousel going on, like ruminating thoughts and going on and so on. And he was like, I need to sleep. And even drugs wouldn't put him to sleep because they would just numb him, and then he was even more numb basically in the morning. And we just did the inner peace process, and he slept 6 hours. That's
great.
Okay, that's not a guarantee that it works, but in this case it worked, and it's beautiful. And because it's so beautiful, and when people have the silent mind, we believe that life will be much more peaceful because there's not the separation into us and them, and so there's less conflict. And with the inner peace, you just feel peaceful, and that makes life much nicer. And that's why on the 1st of May weekend, Inke and I offer a workshop, 2-day workshop, where we help people to attain that inner peace state.
That's great. Does that I gotta be I feel like talking about these things, I feel like most people, you guys are like on a level above what most people are even talking about. I feel like most people are just like thinking about how to, heal certain things, maybe like individual things or certain feelings or certain symptoms. So you guys are taking it to a whole nother level, which is great. But I also feel like it could be a disconnect. I also kind of want to play devil's advocate here, because I've thought about this before with the inner peace process. Like, could that also kind of be seen as like a way to numb the pain, though? Like, does it become more difficult to then go back and deal with that breakup?
Inke, do you want to?
I would say it rather becomes easier because you're not permanently swamped by the noise of all your other stuff that's going on at the same time. You can focus on what you need to heal much more precisely.
Okay. So you can kind of pick them out? Like, today I want to deal with this, and I'm more centered to be able to not be overwhelmed by other stuff going on that might distract me or might make it unbearable?
Yeah. With the inner peace, essentially you only have one stuff going on, and that is what's in your present. And if you're not happy with your present, then you can work on that.
Okay.
And else, that's it. Then you don't have anything to deal with it.
Okay.
So
it does.
Actually,
it does. How should I explain that? Like, most people are not aware of that in their normal state of being, like, a lot of their trauma strings are vibrating or resonating with whatever is going on. And again, that is being considered normal. But it's really much nicer if that's not the case, and you really just have to deal with what's going on right now. And yes, if there's a breakup included, that would be painful, but it doesn't bring up all the other separations, abandonments, betrayals, breakups, whatever, and you go, all over the place. Yeah? You really just have one thing to deal with.
And these all over the place, for some people, it's not emotions that come up, but it's just feelings in the body, feeling agitated, for this guy it was like having the heart pump harder, okay, because of the sympathetic activation. So he couldn't fall asleep because the heart was pumping, because the heart thought there was a tiger and it had to run from it. And actually was all these traumas triggered. And so with the inner peace, his heart was normal, and he could sleep. And he could fall asleep, and he didn't have all these thoughts as well. Like these ruminating thoughts is also a sign of trauma being triggered, and that is not very unpleasant. And actually, from your question, the opposite is true. Most of the coping mechanisms we learn in therapy, we learn by watching our parents, our peers, like eating ice cream or thinking about something else, trying to avoid places where I've been with my ex and something like this. All these actually hinder us, or most of the time hinder us, to actually process our pain, process our trauma. Emotions are there, emotions have to be processed, and if we try to cope with it and try to move to a different place, it's still stuck inside, okay? And then it will come up with the next breakup, and it will make it even harder.
That makes sense. That makes a lot of sense. Wow.
Okay. And coming back to your question, there is a bit of truth in it, because most people are not used to have so little charge going on in their body. So they often have a kind of transition period where they think everything's okay because they're not noticing when they're activated, trauma's being activated in the present, because they're just not used that the threshold is so low.
Yeah, that makes sense.
They have to recalibrate a little bit that, it's not everything, not the house caving in, I just notice a few loose bricks here.
Got it. Okay, that makes a lot of sense. Inka, can I ask you how long you've been with the Institute?
I started my career with the Institute in 2006, so that makes it, 15 years now.
And before that, were you practicing as well? Were you doing any other form of trauma therapy, or like how did you get involved into this field and doing this?
Actually, it was because of my own story. A breakup seemed to be a great way to start this kind of journey. I went through a very painful breakup, and I had some kind of behavioral and talk therapy, and that took forever and didn't really help much. And then I had a friend who told me about breath work. Then I went that way, and that was definitely already a step up from the kind of help that I got through that. But eventually my breathwork teacher moved on into this new paradigm, and when she was connecting with Grant McFettridge. And I kind of followed in her footsteps, and when I realized that there's a way to really deal with stuff, and so that it never has to come back, it's just like, okay, next, we don't have to deal with this again. That was really a new experience. I said, okay, this is the bee's knees. This is what I'm going to do. And then there was really the wish to do this and help others as well with the tools that I had been learning there.
Yeah. That's incredible. That's great. That's fantastic. Daniel, I know you work at a psychiatric hospital, correct?
Yes, that's true.
And so how long have you been wanting to, be in this field, and, how did you get started?
I've been interested in psychology already for a long time. When I did my rotation for occupational medicine, I had the pleasure of having in my company a psychologist, and she was very happy teaching me stuff. And so I already used that in occupational medicine. In occupational medicine, we before had to deal with toxic substances, and had to deal with heavy work, and now we have robots doing all this stuff, and we have machines lifting things, and we have exoskeletons, and we have very highly restricted list of how to handle toxic chemicals and so on.
Mm-hmm.
So basically, it's not completely safe, and there's still work to be done, but the innovation in that field is over. And so occupational medicine was looking, okay, let's see what other things, after we've climbed that ladder, let's see what other things are causing troubles in the work field. And there, obviously, psychologically, the burnout thing was coming up. People would get burnout or bore out. And so that was, during my residency, was one of the hot things which started then. And so I was happy having that psychologist teach me one or two things about it. And so I already did that, and I did mediation talks, and I did try to find ways to bring people together and try to find their needs. And and that continued. And then also some work problems where I was basically in the middle between one side of the company and the other side of a company, brought me into a difficult situation. And I saw a psychiatrist, and he said, well, you just have to take drugs. I said, no, I'm not taking drugs. I want to solve that. Why? I'm in that problem, so I have to get out there somehow.
Yeah.
And that's how I started my journey to try to understand what makes our psyche tick. And as I mentioned before already, I went through several trainings, and then I found the institute. And because it's very much to my scientific mind. It has certain principles. It's reliable. I can repeat all the successes. I can tell when something is failing. I can diagnose it, why it failed. Mm-hmm. In some therapy techniques I did before, I was blamed as a client of not doing it right. Okay, which is unthinkable. I mean, the therapist is the one who has to guide somebody who's seeking for help to that point where this person wants to go and what he or she said he could lead them to. But after the session, you didn't get there because you did it wrong.
The therapist or the client?
No, the therapist told me. I was the client, so the therapist told me I did it wrong. I was like, okay, I feel sad, and you tell me I did it wrong.
It's your fault.
I'm more sad.
I do find that. Go ahead.
Like insult to injury, right?
Absolutely. I think it's when I was doing psychotherapy for a while, because for me a big part of my story was that I basically had, the best way I can put it was, I had an awakening in the most painful way possible. I went from being someone who had I feel like the closest thing is I must have been in some sort of just peak state, because I studied psychology I graduated with a psych degree, and then I decided not to do psychology. And a lot of things, like to be a therapist, but a lot of things happened around that time, and ultimately it kind of awoke a lot of things in my life. And then I started feeling things that I'd never felt before, and I was like, what is this? Like, I didn't understand anxiety. I didn't understand ever feeling depressed. I didn't understand feeling burnt out, stressed very quickly. And little by little, I started resolving them. And I am very grateful for psychotherapy. And when I say resolving them, I mean like to a place where I could move to where I am now, which is learning more about trauma and myself. But one thing that always shook me is, it's almost like a motto that I feel like that psychotherapy has, and which is, like the therapist isn't supposed to heal you. And I always found that very conflicting, because it to me it seemed like a scapegoating thing. It seemed like, like if I help you, like you're welcome, but if I can't help you, like it's not really my fault. Like, and it always seemed like, as a medical profession, it harmed the profession itself. Like, it said, we actually are not really sure how to completely help people. This is a new science, and like it is, but it's also, it just kind of takes away from the fact that psychotherapy is so expensive, and you'd expect for those prices that people have to pay to get better to have real long-term solutions. And it also seemed like a cop-out to me. So when you said that, like, I think that's why I shifted to trauma healing, because I was like, there's got to be more. Like, something in my gut and my heart tells me, like, this isn't everything there is out there. There's got to be something more. And so far, it seems like there is. So, yeah.
And you put it beautifully. Psychotherapy is helpful. It helps a lot of people. And if we wouldn't have it, there would be lots of more suffering in the world. But it's very time consuming, and it's costly, and you don't get a guaranteed outcome. Okay, think about bringing your car to the car repair shop, and they say, yeah, let's see, but I'm not sure if we can fix your tire. I don't know, but you still have to pay. Difficult, right? And so that's why in the Institute there's this pay for results. We just pay for your results, as the term said. And let's go back to that peak states you were saying. So you remember how you felt before you went into all that trouble?
More or less. I mean, I felt like I was much more connected to my emotions. But I also think the opposite. I don't think how do I put it? I don't think I'm not as connected to my emotions. I just think there's so much. There's so many things that I still need to heal that I feel constantly. Like, they're usually in my body in one way or another. And I feel like they get in the way. So, like, I know, I don't know where I saw this, but I know Grant talks a lot about, a lot of people are thinking a lot about how to not feel bad, and they're not thinking about how to feel good or how to feel better. And I feel for me, it's more like there's a lot of stuff that's in the way, and it's almost like blocking and taking space from where I should just be feeling calm and feeling a certain way. But I also just felt, I just felt great. I don't know how else to put it. Like, I didn't have, like, a perfect example for me, and a very clear-cut example that you might think about trauma in most people's terms is like abandonment. I had a father who walked out on me from a very young age, and I never really thought about it. Like, it wasn't something I registered as a big deal. I loved him, and for a long time, like, that's all I thought. I didn't have any conflicting feelings. And when everything kind of came up and everything kind of became unleashed and was like, hey, like, look at all this stuff you got to deal with now. Like, this is what you got to deal with for the next few years. That was one of the things that showed up. And this kind of abandonment and this frustration and this... and I didn't feel that before. Like, it wasn't a thing. And I feel like those kind of things started to come up. There were subconscious things that I dealt with. Like, I was insecure and I had self-esteem issues. But at the end of the day, life felt pretty great. Like, overall, as a whole. Does that make sense?
Inka, do you want to say something to that?
Not really. I think I'll leave that one for you. I'm a bit fizzling. It's 9:30 in the evening, and it's my bedtime.
Oh, no.
Okay. So the thing is, you might have had a peak state. You might have just had a peak state which was just pretty normal to you, and due to whatever happened, you lost it. And the beauty is, if you really can recall the feeling, the sensation, the situations very vividly, there might be even something where we can help you. And there's a process which we call experience to state. So whenever somebody has had a peak experience means that for a short period of time, temporarily, they had an experience of a very high functioning consciousness.
Uh-huh.
We can, with a special process, we can reactivate that experience and make it permanent, to make it a state, to make it a peak state. And this is a pretty cool process. It's not simple, it's not easy, it takes some time to do it, but the techniques are very easy. And people appreciate it really much when they have that feeling back.
I'm sure they do. How does I'm thinking about Nick right now, because I'm I hope you're listening, and I hope that you're finding this interesting. I love talking about this stuff. But how would you explain all that you're talking about to someone who doesn't really understand like what trauma healing looks like or what it means? Because we're talking about this stuff, and I personally have read a lot of the books that the Institute has put out. But to someone who maybe hasn't, or knows maybe just about psychotherapy and going to therapy, this stuff can be kind of like abstract, you know?
Okay, so you can imagine, for example, if you're in your house, you have your own house, and the water pipe breaks, okay? And the reaction for most people was getting in panic, okay? Trying to, I don't know, turn off the water or fix the hole or whatever is the appropriate thing with that situation. But they would just do it, and they would run, and they would have their heart racing faster, and they would even perhaps scream to their wife or to their partner and do that or call this or whatever. And this is because certain traumas are triggered, and you react in that situation with sympathetic activation. Okay, so heart goes up, and which is good. When there's a lion, you need that amount of energy to run. But when the pipe broke, you want to think. You want to be able to think. But when you run from a lion, thinking is not necessarily the first thing you want to do. You just want to run. Okay,
right.
So in our brains are wired in a way that when we have that sympathetic activation, or the trauma trigger, basically, that there's panic, and you just gotta run. Okay, you take all the blood out of the intestines and you put it in the muscles, and you even just leave something behind because you need to be lighter to run faster, and you just run. And then thinking just the necessary things, so you don't trip and you just go left and right. But it's just basic thinking. It's not intelligent thinking, and not even creative thinking. Is activated. You're just in survival mode.
Okay.
When you heal that trauma, for example, anxiety of losing their house, of having something broken, of being shamed for having done something wrong, or whatever that trauma is that was triggered, then you see the pipe breaking, and you say, okay, what's the next thing? Oh, I go and turn off the water. Okay, so it's just one room that has a little bit of damage, and then I call the plumber. Okay, you're very calm. You're just calm, peaceful, and light, and you just do what's necessary to be done. Okay? And this is not what most people experience as normal, because most people expect in these situations to be completely alert and to be nervous and panicking, but it doesn't help. But if you want to run in that situation, you can run. Okay? It's about choice. So what Inka said, it's if you feel calm, peaceful, and light, that should be the normal state, and most people don't know that. The higher states of consciousness are actually something when we, from the peak state, know that our primary cell, our inner way of processing our daily events works more efficient. And it simply feels good. So you're feeling more functional, you simply feel well, and things flow. And I always take the example of, in English I don't remember, the Skender duck. At Donald Duck, there's the Skender something guy, this blonde guy who always gets Daisy, and if he finds if he wants to go to a restaurant, he finds money on the street and so on. Gladstone Gender, that's his name.
Okay.
And he's in a special peak state because he's in a special where everything flows. Okay, everything just in life works out. While Donald Duck is in the opposite. He has almost no peak states, and he's always broke, and he's always down, depressed, and never gets the girl, and so on.
Okay.
And before the Institute discovered all of this, that actually trauma inhibit peak states, people thought it's God-given. Yeah, there's some babies are born with saint qualities, and some don't.
Okay.
But since we know now that we can heal or resolve trauma, and with that resolving of trauma, we can activate peak states, we can activate a better functioning being, we now know it's not necessarily God-given. Yes, it might be that some people are born with the peak states. You might be one of them. But then something happens, and then you lose it. And now you're not doomed to live your life this way, but you have tools now available to work. It's still a little bit experimental because it's very new. Yeah, it's state of the art. It's not old technology. It's very new technology. Mm-hmm. So we still need to figure out a little bit, but we are pretty sure with most of the things we're saying. And then if we don't know, we'll let you know. Okay. Yeah. We have the courage to let you know what we don't know. And I think that's very, very important. So you know what's your take on what we say.
I think that says a lot about you guys. I think that says a lot about the Institute and the especially when people have it's so much new technology and information, and that is a good heuristic to kind of, give you guys a chance and learn more about something that's very personal to most people and not very easy to talk about. Inka, I don't want to keep you if you have to go to sleep. I just want to say thank you. It was really great to hear your points, about your experience. Thank you for sharing so much. I want to be able to help you guys kind of. My idea is to kind of continue this. I'm going to be joining more trauma rooms and make more friends so that I can invite them here, because only when people follow you can you invite them. If you follow them, you can't really invite them, which I just found out right now. So, and my idea is to have people come up and we can talk about if you guys are interested in doing this, but both you guys who are professionals, maybe other professionals as well, to discuss, to grow academically, but also just to have people share their stories and maybe, hopefully, from your experience, tell them what it is that you think it could be, or how you could help, or where they could get help, what it is they can do for themselves, and maybe what you guys can do for them. So what are your thoughts on that?
Yeah, that's actually a marvelous idea, and thank you very much for having me here. I just had the idea that maybe we could talk about interpersonal relationship and how much of that is trauma-based and what you can do about that. That could be one topic we could talk about, because I love the tools that we can offer there.
I feel like almost everyone has that for sure.
And they don't know that there's something that they can do about it. And if anything, they would probably think that the other person has to do something about it. So.
That's very often the case.
That's a marvelous area that we can talk about. Yeah.
Yeah. Well, I will write that. I think if it's okay with you guys, I think I have to go pick up my wife from work very soon. So if it's okay, if we can call it and maybe, Daniel and I, we can reconvene. Inka, if you have any ideas, I'm sure you can get with Daniel and throw them my way. I would also, I know you guys are very busy and you guys are always helping people. You're more focused on already this side of already helping people. For me, this is something that outside of Daniel, I already wanted to do. I wanted to start having this conversation. I feel like I'm at a point in my life where I want to use a platform to get people to. I feel like I didn't do psychology because I wanted to do something that I enjoyed, which is music, but I also care about people growing and healing and leaving their wounds behind so they can make room for who they really are. So for me, this is just like a twofer. I get to talk to two an institute that I really enjoyed learning about, and I'm grateful to, in a way, be part of and learn from you guys and get to kind of, get a sneak peek at like state-of-the-art techniques, and at the same time do something that I know is helpful for people. So, if it's okay, just throw your ideas to me, and I'll do my best to continue growing this so that we can all, help people together.
Sure.
Yeah, sure. That sounds wonderful, Sergio. Thank you very, very much for having me here as well. And I also want to say hi to Nick. And and let's then meet. We'll make an appointment, and we'll find an appointment slot, and then we continue that conversation.
Okay, perfect.
Yeah.
Perfect.
All right, guys. Well, be safe. Have a good night, and I'll talk to you guys soon.
Okay. Have a beautiful Saturday for you.
Thank
Bye-bye.
you. Thank you. Bye, Daniel.
Bye-bye.
Bye,
Bye,
Inka.
Nick.
See you, Nick.
Bye-bye.